Good afternoon. My name is Robert Walker and I'm Brand Manager for RetirementHomes.com. Welcome to our April webinar. We are North America's leading online sales and marketing solutions provider, including our housing directory, our online library, and e-newsletters. We also offer, free of charge to senior living communities, the top experts in senior living every month, who will share their knowledge in the fields of marketing, research, sales, and related areas in webinars such as the one you're about to hear. This month, we present Patty Cisco, president of Ohio-based Cisco & Company, a senior-focused sales and marketing service firm. Patty's presentation, What It Takes to Attract Prospects to Your Website, will give strategies and tips you can use to help boost your website's Google search results. Patty is actively involved with Leading Age Ohio and the Ohio Council for Home Care and Hospice, and is a popular speaker on the senior living circuit. There will be a Q&A session at the end of the presentation. If you would like a question answered, raise your hand in the toolbar to the right, type in your question, and time permitting, it will be answered at the end of the presentation. And now, here's Patty.
Thank you, Robert. I'm really excited to be with everyone today and share with you what it takes to attract prospects to your website. Well, I know one of the questions I'm frequently asked when I speak across the United States about websites are your decision makers really online searching for you? And the answer is yes, they are online searching. In fact, a research project done by Pew Research Center actually found that 8 out of 10 users are actually going online and looking for health information. And so when you look at this particular chart and you look at the age groups that people are online searching, our age groups 57 to 65, which is maybe the daughters, the sons helping make decisions for mom and dad, 83% of that group is online looking. If you look at the moms and the dads, the silent generation, the GI generation, 73 and 69% are online looking. I personally can attest to doing this as a caregiver for my father when he was diagnosed with stage 4 prostate cancer, and we left that doctor's office. That's exactly the first thing I did. I went online, and even though I've been in the industry a long time as a healthcare provider and knew what it meant, I needed more information to be able to help them in making decisions. People predominantly use the internet in 3 distinct ways. They're either sharing content, such as blogging, website pages, videos, articles, or stories, or they want to get in there and learn and discover, such as healthcare connections, like how to cope or treatments, diagnosis. They're also using Facebook to interact with friends and seek out connections and look for support. As we think about individuals as they age, their social network shrinks. And so Facebook is a perfect avenue for them to widen their circle of friends. And the third way is to seek or make recommendations. Actually, our customers are really in control today because with online internet access, they have the ability to share their thoughts about our services, to rank, review, etc. on how they feel. And interesting enough, people are more likely to look to recommendations that others have made about a particular service before calling a service than relying on the service and the information that they're sharing. And mobile internet use is growing, and it's going to continue to grow. So as we consider looking at our websites, thinking, are they mobile ready? In this particular study, also done by Pew Research, there was 1 year change in use of cell phones to access the internet by 52%. And if you look at this particular chart, look at how people are using their mobile phones. 72% are texting messages, 38% are accessing the internet, and 23% are actually using it for a Facebook, a LinkedIn, or a Twitter access. And mobile use is going to continue to grow. In fact, interesting enough, my daughter needed to replace her cell phone, which was the flip type of cell phone. And when we walked into the internet store, and this was just 12 months ago, the internet store said, sorry, we don't have flip phones anymore. And we knew they had them in the back, so we were able to finagle another one out for our daughter. But the fact that they're not on display, they're not selling them openly, that's really the movement that they're trying to say, is that by 2015, in many instances, smartphones, iPhones, etc., they're actually going to overtake personal computers. So making sure that our websites today are mobile ready, or in many cases, if we have a very large website, we may have to have a mobile site to complement it in order to provide access to these users who are using their phones. Now, another avenue to take a look at when we think about, are people really online looking? Traditionally, in our senior care and living services, we've always been followers of hospitals. And so this particular study done by hospitals indicated what hospitals were doing as their main strategy focuses in 2010 to enhance their patient experience. And it hasn't changed too much for 2011. But the number one thing they were looking at was first updating their website, and then they were also looking at how can we provide more information to help our patients online, how can we retain existing patients, and how can we use social media and networking to stay connected and engage our users. And of course, the other thing we know about our senior care industry is, if you're familiar with accountable care organizations related to healthcare reform, how that's dynamically going to change how we do business, especially if you're reimbursed by Medicare. And so hospitals have been looking at, okay, how can we engage our patients? And again, now look at the shift. Now they're saying, okay, website is still a primary focus. Providing more relevant information or technology to help patients online is more important. And retaining existing patients is extremely important. And so they're looking at avenues through their websites to enhance and engage patients and customer satisfaction. And one thing to consider today about websites, years ago websites came online, and they were very much just like your brochures. In fact, we call it brochureware today. If we see a website that looks very old school and was just basically modeled off of a brochure. In our world today of word of mouth in digital age, we need to think differently about what the real purpose and function of a website is. Websites make it easy for us to share and forward information to people. We can reach out quickly to people with information. We can positively endorse our brand, generate leads, create and maintain long-term relationships, and one of the primary reasons that many of our senior care providers use websites today is to look for qualified staff for positions. We like to think about websites today as the hub of our marketing activities. So traditionally, when we were looking at marketing plans, we used to think of the basics, like newspaper advertising or billboards or events, direct mail, all things still very relevant. But today, when we think about how to integrate our marketing, we really look at our website as being our hub, because anything we do traditionally should always pull people to our website. So our website, along with the other supporting avenues available online, such as blogs, YouTube, social media avenues like Facebook, email marketing, banner ads, press releases, and of course, if you have the ability to have an online customer relationship management system, again, all working together to pull people to your website. So what I'd like to do is share with you some things to consider if you look and evaluate your website today, and you can kind of make a list as we go through these different examples to say, well, how do I rank? What does my website look like? Is it brochureware, or is it a very engaging avenue of a website that keeps people on my website? So taking a look at this predominant website, this is a website that we actually repositioned for this particular private duty home care agency. And so one of the things I'd like to always point out is you should make it easy to do business with you. If you can see at the top right-hand corner, you can see how the phone numbers are predominant and easy for people to access. They don't have to hunt anywhere for them. This particular situation, it was important for them to have their address up there as well. not everyone has that particular need. Next, look where it says aging eyes. Make it easy for visitors to make your website easy for them to read. You don't want to have a small font. You want to give it so somebody has bifocals or aging eyes when they're looking at things, they can enlarge that font and make it easy to do business with you. The other thing I want to point out on this particular slide, anytime that you're looking at a website on a screen, you're going to do what's called above the fold. And you can see how I've pointed to above the fold, your taskbars at the screen. Anything that a viewer sees above this is the primary landscape of their website. And so typically on a home page, if a visitor is there, they have 30 seconds to decide whether they're going to stay on your website or not. So anything above the fold you want to make very clear, very relevant to them, and you can't make everything important. You have to pick what's priority and stick to that. In this particular website, one of the things I like to point out is easy navigation. Make it easy for people to utilize your website. A couple of things is, again, if you look at the top right-hand corner, you can see that there is a navigation bar up here with secondary areas of information. But the predominant areas are very bold, very simple. Welcome, why Buckner, our services, and talk to us. Very clean, very simple. The other thing to point out is you can see that there's a third navigation area, and that's because this particular organization had multiple campuses and wanted to make sure that they all stood out. So again, very simple, very clean, very easy to do business with. So anytime that you can make your site easy, clean, it's going to be easier for your visitors to want to stay on it and go to the next page. Now, this particular site is very interesting. This was actually a recreational therapist who went in business for themselves. And so a couple things I like to point out is, first of all, your brand in the upper left-hand corner. Typically, your brand logo should be in this predominant area, somewhere up in the header. And you can see that your brand is going to be consistent with other colors used throughout your site. So typically, we like to say what's called rules of three. Your color palette should be within the realm of 3 predominant color areas. Again, look at the call to action, makes it easy, telephone number, email address here. What I really love is the phrase, convey what you do at a glance. You can tell at a glance what you expect from your activity program. This is speaking to activity directors, administrators, etc. Right away, they're pulling in compliance is important, relevant activities is important, and person-centered team approach is important. So convey at a glance what the emotional appeal is to your audience so that you're engaging them right away. Now, this particular site, what I like to point out here is a lot of folks are not familiar with what's called a landing page. And so a landing page can be either a page that stands alone or is a page inside your website that visitors can't see, but you may use it for a particular campaign. And I'll give you another example here in a little bit of that. But to point out, in this particular situation, this particular organization was adding a new service line on. And so we designed this landing page to be very specific to this campaign. You can tell, again, a captivating header, finding it difficult to manage the needs of an older loved one. Right away, that's what your audience is typically asking. Personal video, very important in this particular situation because it was a brand new service. It was very personal. It was a geriatric care manager. And here, this particular video is really sharing, you know, what that telephone call sounds like that they receive every day. And the other thing I wanted to point out, and I'll give you other examples of this as well, you want to have robust resources. If we were to flip to this Tips for Caregivers, it's actually a blog where this particular geriatric care manager is actually putting on there on a regular basis very helpful and relevant information to me as a caregiver. So I know how to take care of my mom to the best of my abilities. This particular site points out content. Content is king on your website. It's extremely important for multiple reasons. First, you want it to be engaging and compelling. You don't want to feel like it's about you, but you want it to feel like your audience is speaking to their emotional needs that they have. Second, your content is also very important from a search engine optimization standpoint. What you can't see behind what I'm showing you is there's actually areas where things such as descriptions, title tags, meta tags, etc. are very relevant to helping people find you when they go into Google and search for your particular service. So content has several relevant importance to it, so we always take a look at that content. Now, this particular site, what I like to point out is look at the service outline: independent living, assisted living, memory care, adult day services, etc. Where the site I showed you before really wanted to focus on their different geographic locations, what this particular organization did, even though they do have different physical locations, what was more important to them was for their visitors to understand, here's our services, because people are going to look for services first. So this was a really, what I feel is an excellent way right off the bat. They pulled those services right out. Look right below there where I have share. Again, one of the things you want to make it easy to do on your website is have sharing opportunities. If I am on this site and this particular page is of interest to me, I can click on one of these sharing avenues and easily share it with my brother or sister who lives in another area and help them see what I'm seeing as I'm looking for maybe some places for my mom. The other thing is very strong call to actions. You can see where I have invite. In your body of your copy, again, have a call to action, asking people to do things. Think of your website just like you would a sales funnel. Your website, every page of your website should funnel the visitors to do something, asking them to do something. And again, look at the eCare diary. It's a strong call to action. It's giving them an avenue or reason to pull them in and invite them to do something. Even though you can't see all of the testimonial, having testimonials, making it very personal and relevant to your site and frequently keeping them changed is very, very important. Because remember, people are more likely to buy because someone recommended you or had utilized your service than the fact that you're talking great about your services. And think about adding value to your visitors. eCare Diary is a great avenue or a tool that people can use to add value to their websites. And when you think about, I think about my situation, I took bags of pills. I had to find Medicare cards. I had to try to coordinate appointments, try to maintain medication and prescriptions. All of that information is very overwhelming for a caregiver. So if we can find a way to help caregivers and at the same time generate leads on the back end, that creates value for both our visitors and for us. So in this particular situation, if a visitor wanted to learn more, they could click on Learn More, which would take them to a customized landing educational page, would help them understood what eCare Diary was, and in turn they had the opportunity to create their own diary. And when they did, it took them to a very personal page where they could access the calendar, the scheduling, the content information, medications, sharing, etc. So think about ways that you can add value to the visitor when they're on your website. This particular site, look at these questions, commonly asked questions, and this is a nursing home. And so I oftentimes hear from nursing homes, oh, we don't need a website. But depending upon where you're located and the type of services that you're offering, a website can actually enhance your customer satisfaction. And so this particular thing I like to look at is look at the frequently asked questions that they get when people call. What service do I need? What can I expect? What's the cost? And when they click on See Answers, it takes them to a specific area on the website that can help, again, funnel them in to help them understand the services they need and how we could help them. The other thing, when you think about customer satisfaction, what is the predominant #1 thing we hear over and over again is we need more communication. Well, if we can keep our families engaged real time, real access with what's going on with the activities today. So if I call up or I show up, I knew what mom should have been engaging in or what she could have been engaging in. And those are great conversation starters for me. So look for ways within your website to figure out how can we add value to our customers. One of the things that we're seeing a lot of today is senior care providers want to make it easy for clinical referral sources to do business with them. So whether it is a physician portal, which is more sophisticated, or it's something as simple as an online referral form, such as this skilled home care provider, what we have done is put on here a HIPAA-protected online referral form that if a physician's office wants to refer a patient to them, they have all the relevant information that they can put in here, and it goes directly to the home health care provider, and they can immediately begin having conversations and delivering the services that they need. So again, you have many potential customers that could be visiting your website, and you just want to evaluate what's the best way that I can offer services and assistance to make it easy to do business with us. You heard me mention earlier about hidden pages. You can tell on this website who we are, care for you, why choose us, etc. None of those titles actually explain this page, and that's because this is actually a hidden page that we've built into this site. And this is an example of how you might use this as a campaign. So we all know that we have certain holidays where we honor people, physicians, social workers, etc. So a perfect example in this particular situation was invitations were created honoring social workers that this organization did business with. And the invitation said, we know you do a lot of hard work, thank you very much, etc. And we have a free gift for you. Please go to www. whatever that URL was and access your free gift. And when they did, they came in here and they could see that they could either get a $5 Starbucks or Chipotle card simply by giving their name and their contact information, etc. In return, what the sales reps for this organization would do then is physically hand deliver those cards to the social workers. So in our world of getting touches, if you will, the more touches you have, the stronger the relationship. By engaging your website and using online marketing, you're doing the blend of what we call integrated marketing between traditional and the non-traditional forms of marketing. The other avenue that we see quite frequently is how can our nonprofit senior care providers be using their websites to be more relevant with fundraising strategies. And so this is a really neat example. If you think about, a bride getting married, a baby shower, they have gift registries. So we actually created a gift registry for this particular website. So a visitor could go on, they could pick, I want to do the air mattress, and right online pay for that air mattress. So that's one particular avenue. We have others who have wish lists. You have others who can give different sums. You have campaigns running. But your website can be a great avenue, and especially when paired with other social media strategies, to enhance your online fundraising strategies. This is a particular site. We did not create this site, but there's a couple of things that I really like about this site. Again, look at how you don't have to figure out what the services are. Right away, they're very clear. Homemakers and companions, I can go here. Personal care assistants, I can click here. Live-in caregivers, I can go here. Again, make it easy. See where the phone number is right off the bat. The other thing is, look how they've positioned their blog. My take on a blog is if you're going to use a blog, then you have to use it correctly, use it consistently, otherwise don't put it on your home page, and in some cases don't have it at all. But a blog is very relevant to helping you with search engine optimization. And again, look in the body. They've made it very clean, very simple, how to do business, how to connect with them. This particular website is not ours either, but it's one of the best websites that I have seen where they really showcase what I feel is our greatest asset, and that's the people who deliver our services in the senior care business. Our maintenance folks, our laundry folks, our cooks, our frontline folks who oftentimes are behind the scenes and can be maybe seen as being overlooked. So I put this website address on here. I think it's a great place for you to go and take a look and just see how they really integrated this campaign into a very, very well done avenue of showcasing what truly is great people doing great work for this particular organization. The other thing that oftentimes is something to consider is you want to do more than just talk about your services. You want to be very helpful. This particular situation I want to share with you, this organization was actually kind of on a state line between West Virginia and Ohio, and they serve both markets. But they were in a rural area on both sides of that fence, and what wasn't relevant in their community was kind of a resource, if you were, where people could go to and find what was helpful for them. So what we actually did was create two different resources, one for their Ohio, one for their West Virginia market areas. And when you went to these, you could find local community-based services that did Meals on Wheels or pharmacy or what have you. But it was very relevant to the type of services that they were offering. This organization was already doing that intrinsically, but now they just tightened it and took it online to be able to offer it to users who may be visiting their site. Now, you heard me mention earlier about blogs. A blog is really a great reason to get people to come back to your site over and over again. And so providing relevant content on a blog, not just about, oh, we had a great event, but give them helpful information. We actually offer blogging services that are done by geriatric care managers, nurses, et cetera, depending upon the services we're providing support for. But they're writing articles relevant to what our sons, daughters, folks who are actually those caregivers, the information that they need and really don't think about. So your blog is a really very helpful resource for people to come back to, number one. Number two, it's also very relevant to search engine optimization. In some ways, every time you're adding a blog to your site, you can add what you may consider in your mind as another page. And the more pages you have, the more likely you move up in the Google search. So there's many, many reasons why a blog can be very helpful for you. But again, you need to make it so it's relevant content, it's genuine, it's helpful, and you need to be consistent at it. Now, I mentioned earlier about mobile sites. This is an example of what we would consider as a mini mobile site. This particular organization has a very large, robust website, but we actually developed this mini mobile site, number one, very specific to a campaign need that they had to fill an occupancy for assisted living, and then also to help make it very interactive and engaging. So when you were thinking about a mobile site, less is more. Those phones aren't that big. So you want to make things very short, very sweet, very simple, very easy for people to access and find. Search engine optimization, something that I've been talking about throughout different areas that I've covered. It's really important that you think about search engine optimization. Some of the website discussions, people are very concerned about how it looks. That's very important. But sometimes what's even more relevant is what you can't see on a website and what's going on behind the scenes and how to make it so that people can find you. So Google it's very important to consider your website and making sure that it's optimized as much as possible. And so you want to consider paid versus organic optimization. When you're thinking and you go on Google and you look, anything that's in this pink initial area, those are people who are paying to be there. And statistically, interesting enough, it's shown that many people won't even look in those pink areas because they know people are paying to be there, What they find more relevant is what's called organic optimization. They know when they're looking for services and they're popping up below the pink area, those are the ones that are most relevant. So you want to be found on the first page of Google. You want to be above the fold. Being in the pink is certainly an option, but being organic is more cost-effective for you in the long run. Some things to consider with search engine optimization that will help, again, blog copy, photos, images, videos, very, very important. News releases are important, ways you can use that with internet marketing, as well as article and press release publication. Other things such as YouTube, if you're having videos on your site, making sure they're linked to your YouTube. A lot of folks don't understand that social media platforms such as Facebook, Twitter, LinkedIn also help with your search engine optimization to your website. So I'm not saying that you need to have all of those things, but to consider if you do have those things, are you using them in tune so that they're helping you with your website? Google Places, very important place for you to be. It does help with your search engine optimization. Google Places is free. It's a great way because it's geography-based. So if you have a physical place where you have an office, you have a nursing home, you have an independent living, home health, etc., it's very important that you're on Google because a lot of people search predominantly by, let's just say, home health, New Bremen, Ohio. And so you want to make sure that not only what's going on with your website behind the scenes is helping with that, but Google Places and making sure you're doing all the things relevant to Google Places that it's asking for is also very important. Other things such as inbound links, keywords, title tags, title descriptions, image tags, all things that are behind your website that you can't see, they are still relevant and important in helping with that Google search. So when you think about website today, don't just think how pretty it looks, but you need to look at the whole package of a website. These are things that weren't important before when we had the brochure-aware websites. Now they are equally or more important than the design itself. So things to think about when you're looking at your website and your checklist, or you're thinking about doing a new website, these are all the things that you should see embedded within a proposal or asking questions about. Inbound links, also very important. It indicates a way of who's really looking at your website and if they're linking to you. And so organic links are extremely powerful, and that's what you want to build upon. The other thing that's important with websites today, and it's one of the things I actually love about internet marketing, is that I can measure what I'm doing on the internet. When you think about a billboard ad, a newspaper ad, a TV, those things that are very expensive and you can't always see your return back on investment, whether they're working, not, how to change them up. Compared to an internet strategy, you can do that. And with websites, it's very easy to do with what's called Google Analytics. And Google Analytics is free. You can go onto Google Analytics. You can sign up for it. It should be a code that's placed on every page of your website. And then you should understand it should be part of your strategy on a regular basis that you're going in and reading those. And so this is a particular, just a snapshot, if you will, of a Google report. And so there's going to be things that you're going to see. A dashboard's going to tell you over a period of time what was going on, what was the traffic on your website. It's going to look at how many visits you had, what pages they were looking at, how long they're spending on your website. If you can get people staying 2.5 to 3 minutes on average, that is really good today with your particular website. And so these are all different factors that you're going to look at where people are coming from. Referring sites. Many people are going to come, as you can look at this, well, they're being referred from other sites. They're direct traffic, meaning they typed in your URL address and got to you that way. They're on search engines. The orange shows the search engine. So people are finding you because they went into Google and typed in, you know, home health, New Bremen, Ohio, and so that's how they found you. So really important to look at your measurements, and to track those on a regular basis. And the other thing to think about when you, especially whether you have a new website, you want to do a new website, but what are you measuring the success of your website on? And you can't have a laundry list. These are some of the things when we're working with an engagement that we say, okay, what's really important? What you want your page to do? What do you want your website to do for you? And instead of having a whole laundry list of things, we start to really narrow down what's important, and then we can focus on that and implement that into the strategy of the website. So really give thought to what you're gauging success by. I always kind of chuckle when people say, well, I want to increase my census. Well, I think the reality is we all know that your census or your occupancy isn't going to increase as a result of your website. What we do know, though, is you can generate more leads through your website, which then in turn those leads are dependent upon the person engaging in the relationship, the conversation, starting that selling process, which in turn will help with your census and your occupancy. So we need to be realistic about what our expectations are with the website. And again, think about your website as a lead generator, and in turn, what are some things that you do to make that very relevant? You want to engage with value, such as that example I gave you with eCare Diary, or other things that they're logging in to access tools and helpful information. Remember, your goal with your website is to act as a sales funnel. So you're going to funnel people through. At the end of the day, you want to be able to get a conversation with them over the telephone, in person. That's your ultimate goal. You want to continue a relationship, not just at the beginning of the service, but think after they've used the service. If you're doing short-term rehab and you're sending people home, if you're doing home health and they discharge from your service, they are your best customers to come back and or share others with you. So continue building a relationship and think about how you can use your website to do. You want to make sure that you're very genuine, you're very authentic. People can tell if we're fake. And so websites today and social media and internet marketing is all about being genuine. So be yourself, be personable, and make sure that what you're conveying is very personal and emotional based. Ask for a response. On the website, you need to be guiding and directing and asking people, telling people what you want them to do. Click here to get started. Click here to ask for more information. Discover more today by doing. So be very forthright in directing and guiding people. Be patient. I love it when I have asked CEOs how long will it be before they start getting leads or they start getting their occupancy filled. Again, we need to be very realistic about what our expectations are. The reality is internet marketing is growing. It's not going away. So the longer we wait, the harder it's going to be as a competitor, your competitors around you get on the bandwagon and really understand how to use this to their advantage. So I always say it's better to be on the top rung of the ladder in your market area than it is to try to catch up to everybody else. But also understand that internet marketing is what we call a long tail strategy. It takes a while to build relationships online. And so we need to be very patient and very realistic. And we also need to be using those measurements to constantly be evaluating and changing information so that we can find that right sweet spot that's going to work for us. So don't be despaired if the first time you make a change and it doesn't work, or you get a new website and you're not seeing what you want. That's because you need to test it and you need to change some things on a regular basis to get to that right sweet spot. Be creative. Don't be afraid to step outside the box. And again, you want to create a great experience. Whatever experience you create on your website is the experience people are going to expect when they get on the phone with you, when they visit your community. So be creative with what you're doing and make it a favorable experience so they want to share it and they want to come back to your site. So we covered a lot of information. I hope that you have a great checklist, if you will, of things that you now can go back to your own websites and take a look at and kind of gauge how you're doing. Remember, websites today aren't brochureware. If your website typically is more than 2 years old, chances are it's probably time to definitely look at refreshing it, especially if you want to be found on the Internet. Be intentional with purpose. A website today is the hub of your marketing, and so you want to be very strategic about it. Again, when we start working with a client, we do that cultural assessment, which is really imperative to creating the site that really is going to work for them. So be intentional with what you want that site to do. And think about, it's not just the website itself, but it's also, you need to consider with your website the strategy of search engine optimization. This is such an important piece that so many people aren't going the next step to do after they have a new website to develop. So there's basic components within your site, but there are also strategies that you need to be engaging in once your site goes live to keep it sustainable and getting found on that first page of Google. So with that, Robert, I will turn it over to you and see if we have any questions. We have a bit of time left. I'd be happy to answer any that are available if I'm able.
Yes, thank you, Patty. We have a couple here. Will my website work on every mobile phone?
That's a great question, and we do get asked that question. There are so many mobile phones that it's virtually impossible to test every website on every mobile phone. But there are what I would call some foundational phones that typically a website is going to be tested on to ensure that it is working. But it is unrealistic to expect that every website is going to work on every phone.
Okay. Now, somebody had a question. What is the difference between a template and a custom design?
Oh, good question. You know, oftentimes, and interesting enough, I have this conversation on a regular basis, especially when people start talking about budgets for their website. A template is going to give you, in fact, all of the websites that I showed you were all custom, meaning it's unique design. You won't find another one like it anywhere. It's like taking a designer and they have a blank piece of paper, and we take that cultural assessment, and you create something very unique to you. A template, on the other hand, you may find another website looking exactly like yours with the same box, the same fields, doing the same thing. So that's what a template website would look like versus a custom design website that's going to be more unique to you and going to take more time to create in terms of that unique design for you.
Excellent. Perfect. Thank you very much, Patty, for that fascinating presentation. Again, that was Patty Cisco with Cisco & Company. The full presentation, including the slides, will be available at retirementhomes.com as well as at youtube.com/retirementhomes in the coming days, so check back soon for that. Next month, mark your calendars for Wednesday, May 16th at 2 p.m. Eastern Time, when we are pleased to host Cindy Heilman of Higher Standards, a dining service training and consulting company who will teach senior living communities how you can keep residents happy and attract future ones with dining and meal trips. And finally, if you will be at the ACHCA conference in Nashville next month, be sure to catch the presentation by our Managing Director Blair Carey on May 7th on using social media to drive business, and come visit us at the Aging Services of California Conference in Palm Springs on May 8th and 9th. Check retirementhomes.com or contact me at robert@retirementhomes.com for details. Have a great day.